Welcome to this health education and empowerment session designed to guide you to navigate healthcare amidst travel restrictions necessitated by COVID-19. I am Dr. Beatrice Kariuki, a medical doctor and a public health specialist, licensed by the Kenya Medical Practitioners and Dentists Council, and I will guide you through this session. First things first, who is the target audience of this video? If you have a previous diagnosis of a chronic disease or condition and are stable, this video is for you. By chronic disease and condition, I mean patients with cardiovascular conditions such as hypertension or heart disease, patients with chronic lung disease such as TB, asthma, bronchitis, and COPD. This also includes patients with diabetes. It is important to note that patients with cancer who have been receiving treatment will have a different set of guidance because of their fragile immune system. Our common goal here is to keep you COVID-free, while at the same time ensuring that you keep the condition or disease under control. This is critical as COVID-19 disease has been proven to be more severe in patients with pre-existing conditions such as those I've mentioned above. This video is not for you if you have a previous diagnosis of a chronic disease, but your condition is out of control. This is evidenced by worsening symptoms or severe illness. If this is you, you will need to access a health facility through the casualty or outpatient department for immediate care. This video is also not for you if you do not have a chronic condition but are suddenly ill. Similarly, you will need to access a health facility through the outpatient or casualty departments. If you do have COVID-19 symptoms, you need to call *719, the contact center set up by the government. They will guide you on the next steps. Why is this video important? As part of treatment, management, or control for chronic diseases and conditions, patients like yourself require to make regular or periodic visits to the health facility. These could be to see a specialist or for a regular checkup. Sometimes you need to have your blood monitored or other tests done. Other times you need to collect medication for your use. What challenges are you likely to face during this COVID-19 period? Firstly, you find that you may not be able to keep your appointment date at the health facility where you usually receive care due to the following: concern that you may contract COVID-19 during your visit to the hospital, as this is the same place where COVID-19 patients are being treated. You're not able to access the health facility that you usually attend due to travel restrictions or the night curfew. Or you're just worried over the availability of specialists or whether or not the clinic will still run. My guidance here will be based on the guidelines that were released in late May by the Ministry of Health to county governments to ensure that essential health services are accessible to all Kenyans during this time of COVID-19. Before delving into the specifics, there are a couple of general things that are important to understand in regard to the response to COVID at the health facility. First, only a few health facilities in a county or a locality are designated as isolation and treatment centers for COVID-19. These are the ones that deal with persons who have been confirmed to have COVID-19. It is possible that your health facility is not one of these. Even if it is, these health facilities will have separated regular essential outpatient and inpatient services and the COVID-19 treatment centers. Additionally, national and county health departments have all been encouraged to have separate triaging areas for patients with chronic conditions or disease because of the risk that I mentioned earlier, that patients with chronic conditions and disease have been found to have more severe COVID-19 disease than the general population. So, some specifics on how to access the healthcare that you need in this time. If you need to attend a health facility which can be reached on phone, it is advisable for you to call the health facility and inquire about the arrangements they have in place for appointments. If you need to attend a health facility that cannot be reached on phone, you need to reach out to a health professional who works at the health facility and find out what arrangements they have for booking appointments. If none of the above are feasible and the health facility is accessible, you could send someone besides yourself to the health facility to find out what arrangements they have in terms of booking and what your next steps should be. If the health facility you attend is not accessible due to the travel restrictions or curfew, and you have no way of reaching your doctor or a member of your medical team, identify the nearest health facility and seek advice on the next steps. So, what are some of the things to ask about at your clinic visit? Remember, our goal is to keep you COVID-free while at the same time ensuring that you keep the chronic disease or condition you have under control. It is important, where possible, that the number of visits to the health facility are reduced. So you have to take action and ask a few questions. First, ask if you are eligible for appointments that are more spread out than usual. By this I mean, if you go to the clinic on a monthly basis, ask if you are eligible to attend on a quarterly basis, that is, every 3 months. 2, ask about options that are available for collecting medications for a longer period of time. Once again, if normally you get 1 month's worth of medication, ask if it is possible for you to collect 3 months worth of medication, or if there are arrangements which could be made for you to collect the medications from a nearby health facility. 3, ask about the option of follow-up at the nearest health facility and how that could be coordinated with the health facility that you usually attend to ensure continuity. Ask about options that your health facility may have in place for follow-up through telemedicine platforms, phone conversations, phone applications, community health worker visits, and the like. This could save you 1 or 2 visits to the clinic. Ask about what signs to look for that should make you return to the clinic immediately and not await the next appointment date. Important to note, patients receiving cancer treatment need to contact their oncologist or the nearest cancer treatment center for advice. They should not travel to the hospital. I hope this video has been helpful. As I come to the end, I want to emphasize that you have an individual responsibility to keep COVID-free by observing all infection prevention measures put out by the government. Commercial corona